Hey, I'm Mickey, curator of the Aesthetics Bible. Today we're here to chat testosterone and HRT with Dr. Trish Davis, who is a professionally respected HRT and testosterone specialist. So today we're here to discuss hormones with Dr. Trish Davis. Trish has been in the industry for 9 years now, and she is a top specialist in HRT in the country. And today we are going to discuss specifically testosterone within men. It's a treatment I've had to have for the last 2 years, how it's affected me, and also how it can benefit other people. But also on top of that, HRT services for women as well. So to begin with, we'll talk a little bit about my journey. And because I worked in the industry, as always, I've been very lucky to discover treatments at the beginning. I was in a meeting with Dr. Trish Davis discussing her new practice of becoming an HRT specialist at the beginning. And from listening to what the symptoms were of having low testosterone, even though it wasn't initially something that I thought I would have, it then made me test. And thankfully now I did that, because what a difference it's made to my life. So I immediately asked Dr. Trish to give me a blood test. She sent it away, and yeah, it turned out to be low. So from there I've been prescribed testosterone for nearly 2 years, an injection I think every 8 weeks, and it has improved my mood, it has improved my skin, it's improved my whole life. I have less anxiety, if any anxiety. I thought the symptoms that I had were standard for most people and that everybody felt that way. As it turned out, it wasn't. But I've also recommended this to other people who then had it and realized that it's quite a lot of symptoms and it's just part of aging. But what the benefits have just been so fantastic. And it's something I would highly recommend to everybody, which is probably one of the reasons that we are having a chat about it today. And what I want to do is ask Dr. Trish how she has found that her demographic of clients have actually responded to the treatments.
So for me, it's an interesting question, because part of the reason I integrated male hormone testing and management into my clinic, when I'm a predominantly female HRT specialist, is because it's very difficult for men to know where to go to get a test for testosterone deficiency. So there's that issue, and that's partly because of just lack of training in the NHS, because it's one of these things that, unless you've had extra training on it, GPs just don't have time to delve into. And one of the frustrations that I have is that for men, I think there are a lot of men that are suffering that maybe don't realise that their symptoms could be a testosterone deficiency. Symptoms of sexual dysfunction can be quite obvious, and men will think, oh, I wonder if my testosterone level is low. They also might think about testosterone for muscle building, or get offered it in the gym or something like that. That's quite common. But there are men out there with symptoms for which it's just much more subtle. So symptoms like tiredness, anxiety, inability to manage your weight, gaining weight. This is something that I feel really strongly about. I've integrated male hormone testing into my clinic because I don't really think that men have got anywhere to go to have this done very easily. You have to have the test taken under the right conditions. It has to be from the arm, not finger prick, and it has to be done fasted before 11 a.m. And even if men decide to come and have a blood test, there's a whole group of men who might not realise that they even need to have a blood test. Symptoms like sexual dysfunction, problems with erection, problems with desire or orgasm are the sort of symptoms that men will pick up on and go and get tested. They will also pick up on the fact that they may be in the gym, they want to build more muscle, I wonder if I'm testosterone deficient. But what if you're a man who's feeling a bit tired, you're getting a bit overweight, you're not sure why, you feel anxious, you feel stressed, you feel low, depressed. These are the sorts of symptoms that men put up with and don't even think about testosterone deficiency. If you have got a testosterone deficiency, it puts you at higher risk of cardiovascular disease, osteoporosis, obesity, also diabetes. So not only is testosterone an important hormone to have right for your lifestyle, for your but for your general health and for your future health. This is not a lifestyle drug, it's an important treatment for your overall well-being.
Okay, so, but what happens if you have a male patient and he comes in, feels he has all the symptoms, but then he does the blood test and you review it and you say they're okay?
So this is quite a common scenario, especially in younger men. They are symptomatic, and often with those sort of emotional symptoms, it's often anxiety or it's weight. It's building weight and building muscle in the gym type of scenario. So if those blood tests come back normal, I can reassure a patient you do not have a testosterone deficiency, but check it once a year. And I occasionally get asked by patients, but can I have some testosterone to make my levels higher? And the answer to that is you shouldn't. You shouldn't take any additional testosterone. And the reason for that is because you'll get side effects if your body doesn't need it. And they could be sorts of things like hair loss, and a huge one is infertility. The other thing might be skin changes like acne. So be very careful with testosterone because you have to respect the science behind the testing if we're doing the testing properly in the first place.
Okay, so would you say it's basically a lot safer to use you?
What I have done is I've got myself trained up with the British Society of Sexual Medicine. These are the top people in the country who know what they're talking about in terms of the evidence behind testosterone diagnosis and replacement, and safety for men is paramount. If we're following this guidance, and we have to treat everybody as an individual, we know that we're doing the best, giving the best care that we can. If we check testosterone in men and use this BSSM guidance, we know we're doing the right thing. I'm backed by specialists all over the country who would do the same thing wherever you are in the UK.
Brilliant. So obviously we've discussed how this can affect men and how it can help them. What about for women and your HRT services?
In terms of testosterone, if we're focusing on that, I'm a British Menopause Society advanced menopause specialist, which is a real mouthful. But ultimately what that means is I've spent a lot of time learning about the intricacies of menopause management. And menopause for a woman isn't just it's not just a phase, it's what happens to you once you're not producing estrogen anymore. This is you for the rest of your life. And some women need lifelong management and quite complex management depending on their symptoms and their medical history. Estrogen replacement is key, and it depends on symptoms. If you haven't got any symptoms, you don't really need any estrogen unless you're treating something like osteoporosis. But if we come back to testosterone can be the icing on the cake for some of these women. And really, you do things in order. You look after their estrogen deficiency, give progesterone if they still have a uterus, and testosterone replacement, that's your third hormone. Let's not forget that women make testosterone, and if your levels of testosterone are low, like the men, it's just as important to replace that as well.
I think at the minute it's like a minefield for most people. They're online and there's so much information about HRT. But because obviously I'm now sat with the top specialist, what would you say is one or a few main bits of advice and guidance to everybody rather than just an advert off Instagram?
Okay, a really important message is if we're talking about female hormone replacement, don't forget vaginal estrogen. And people look at me when they come to my clinic and I'm asking about sex a lot, I'm asking about urinary function, are you having urinary tract infections, is there any vaginal dryness? And sometimes women look at me and they're a little bit taken aback because it's so important to address the urogenital system. There's a condition called genitourinary syndrome of the menopause. It's a big phrase, but what that basically means is HRT taken as a patch or as a tablet does not necessarily get down below. And most women actually need estrogen replacement in the vaginal and the urethral area, so around where you pee from, because the bladder, the pelvic floor and the vagina are affected by estrogen deficiency. Women who don't get estrogen replacement down there, who need it, then will really miss it. Sepsis from a urinary tract infection can kill a woman. Admissions to hospital because you fell over in the night because you needed to pee and then you broke your hip. These are all really stories that are difficult for me to listen to after being a GP for so long, because I know for a fact that we miss estrogen replacement in women in the urogenital area all the time. Another thing that's a real gem that I would like to get across is that if you're going to treat a libido in a man and get his sexual function back to normal, you give him some tablets to help his erections, you've given him some treatment, which by the way we use at the same time as testosterone, you have to treat the partner as well. So looking at the relationship of that man and looking at his entire relationship, because if you just treat one partner, so men and women need to be talked about in context of their relationships and their life.
So is this a new thing, this gel that everyone's putting on the vagina?
So it's not a new thing, but it's definitely something that's underutilised for women all over the world. Vaginal estrogen is really, really safe. Even if you've had an estrogen-dependent breast cancer, everyone can use it. And the consequences of not using either a little tablet that goes into the vagina at night or a cream that goes on that can be used around the outside as well means a better sex life, fewer urinary tract infections, just much better well-being. And actually, we do lose patients to the consequences of having a low estrogen and having urinary tract infections and having sepsis all of the time.
So one of my friends actually described this as curing her from the Sahara Desert. Can you give me a bit more insight of how that actually works?
So estrogen receptors are present in every cell of our body. And when we take HRT, hormone replacement therapy, through a patch or a tablet, it doesn't get down below very well. It just doesn't really work down there.
So it's more
properly.
direct to the...
So this is direct treatment to the vaginal area and where you pee from. And this is because... So what women will say is, so questions I ask them, does your vagina feel dry? And the answer is often yes. Is it uncomfortable when you have sex? Yes or no. Some women do not have sex because they know that when they go to do it, it's going to hurt. Give them estrogen replacement and they get their sex life back. We're saving marriages, we're saving relationships.
I was about to say, why don't they prescribe this to everybody? The divorce rate might go down.
This is literally what we're campaigning for at the moment.
Right.
There have been, until very recently, warning labels on the information leaflet that you have inside vaginal estrogen, warning patients not to use it because it comes with risks of cancer. It does not. We can prevent admissions to hospital, we can prevent breakdowns in relationships. It's so important that we think about women who are presenting with urinary tract infections, but often people don't tell you, you've got to ask the question.
There's a lot of people that I think have complained in the past of having mental episodes and not really having their stuff together. I've actually got a friend who is a good friend of both of us actually, who told me that she was having a very hard time in her 50s and that you actually saved her life by managing her hormones. But I never really understood how.
If you have estrogen deficiency or if you have swings in your hormones, often what's happening in the perimenopause, for example, where your body's starting to notice reduction in production of estrogen, it's the ups and the downs that can make you just feel really unwell. And often the symptoms are the emotional ones, the anxiety, the depression. And if we just really sort of soften the ups and the downs for patients, they just feel much more like themselves. And in the past, women have presented to their GP with anxiety and depression and been given antidepressants. This is not the treatment. We have to think about hormone balancing. Okay,
so from aesthetic standpoint, obviously you deal with clients not only for their HRT and testosterone, you also are one of the top injectors. So how have you found that dealing with HRT soon affects then the ongoing treatments that you give aesthetically?
So I actually integrated menopause specialist clinic into my aesthetics clinic because the aesthetics clinic was the one I opened first, because I noticed that patients were presenting asking for aesthetic treatments when really I thought they needed their hormones balancing instead. So now we do a holistic assessment of how your general health is. What patients are noticing, they're noticing more crepey skin, they're noticing more elastic skin, more sagging. Their skin is drier with a poorer texture. And they're looking in the mirror and they're feeling like they just don't look as fresh at all. Sometimes you really have no sagging, but it's that freshness and it's that texture and tone of the skin. So what we do in these situations is, if we've sorted out the sort of the medical side, medical grade skincare and using the right products on your skin is super important, that things that look after your skin health. After that, if we're talking about aesthetics, patients can do really well with injectable hydrators, or you might have heard the term skin boosters. Another thing that really helps is biostimulating, so stimulating the skin to produce more collagen, because we're losing collagen all the time in the perimenopause and menopause. And great products for that are things like microneedling with Skin Pen, and also Harmonica, which is a biostimulating injector.
So what are the main benefits between coming to you, having a full assessment and being prescribed your testosterone, over going to the gym, meeting Dave and buying Backstreet testosterone? What's the benefits?
There's a couple of things in there. So I'm a doctor and I treat everybody as a patient. They're not customers. So I'm looking after you ethically. If there's a diagnosis of testosterone deficiency, we treat it and we manage it. Depending on your age, whether we're protecting fertility or not, we deal with you as a patient. If you're not being looked after as a patient, you've really got to ask some serious questions, because there are safety concerns, and you check who you are seeing. Are they medically qualified? If they're not, please don't take it. Do not take anything that is not prescribed by a doctor for a medical diagnosis, because you don't know what's in this. It may not be what we call regulated by the Medicines Health and Health Safety Authority, and we don't know that it might not have consequences for you if you didn't need it in the first place.
Thank you, Dr. Trish, for giving us this valuable information, which we will share.